So let's start at the beginning with what is lead. The history is so interesting because it's been around for millennia. This is a picture of a big hunk of lead on the right, and it's been very popular over the years because it's a soft and malleable metal, and the Latin word for lead is plumbus. It's naturally found in the Earth's crust, and because it's a metal, it doesn't break down. So lead doesn't go anywhere, it doesn't biodegrade. But past uses of lead have caused widespread contamination in the soil. This picture below is an antiquity that is an old Roman water pipe from the plumbing system in Rome. And they used leaded plumbing. And that's why lead poisoning, the old name for lead poisoning is plumbism, because it comes from that old Latin word plumbus, and that's why we have the word plumbing with our pipes, because the Romans used leaded water pipes. And some people speculate that the Roman Empire fell because of lead poisoning. They just lost too many IQ points to keep things going. So the primary issues with lead poisoning is lead in paint and gasoline. So these first two photographs, the first one shows the old Dutch boy was used as an advertising icon for lead, some leaded paint. Some people think it was used by the industry to reassure people about the safety, knowing that there was hazards from lead paint. The industry did know about fatalities from children eating lead paint chips. Nevertheless, lead persisted in the paint. Now more than 80% of US homes built before 1978 contain lead paint. And this picture of the lead paint on the exterior wall is just an example, but many old homes, including the one I live in, most likely has lead paint. It's not a problem when it's underneath well-maintained walls, but once the paint starts deteriorating, it then gets in the house dust, and around windows is a big problem because opening and closing old windows will pulverize the lead in the window frames, and then the wind, the air kind of blows the dust in, and it doesn't take a lot of dust on children's hands to raise their lead levels. So lead was also added to gasoline as an anti-knock ingredient between 1923 and 1996, and so that picture shows an old car, and you can see the fumes. Those were leaded fumes that then settled down into the soil. And like I said, lead doesn't go anywhere. So most old cities, old industrial cities, have soil that's quite contaminated with lead, which is why if you're going to grow vegetables to eat in cities, you should use raised beds and bring in the soil. Or you could get the soil tested for lead. But because lead was in gasoline, it's in a lot of soil. And because it was in the exterior paint too, any paint that might have chipped and broken down is in the soil around the homes. And then of course we have lead in plumbing that was used until 1986. And this photograph is from the EPA website, and the pipe in the middle is from a pipe where the anti-corrosive chemical was not used. So you get a lot of corrosion of the lead. Any leaded pipe is going to have some corrosion that leaches into the water. But if you don't use the anti-corrosive, it's even worse. So those are the main sources of lead in our environment. Now, this is a really important slide that shows you, if you just concentrate on the red or the blue line, showing you the blood lead levels over time and how much it has helped to take the lead out of gasoline and out of paint. Because if you look down at the bottom axis, the bottom line on between 1976 and 1980, there were between 90 and 90% of children, this is for children, age 1 to 5 years, 90% of children had lead levels over 10. So for those of us who grew up anytime before that, they don't even have the numbers, who grew up before the late 80s, our lead levels, over 90% of us had lead levels over 10. And then you see this dramatic difference as the lead was taken out of the soil and the gas. until now we have very few children with lead levels over 10, which is great. And this is considered a real public health win. But that's not the end of the story. Now this line shows the percent of kids that have high lead levels. And so this one shows the actual lead levels. You can see again, back in the second half of the 70s, the average lead level was almost 15. So I'm just assuming that when I grew up in the 60s and the 70s, that my lead level was over 15. And then boom, by 1988, those lead levels have come down. And then this latest reading on this study was from 2007 to 2010, and the average lead level in the country was 1.3. So that's really low compared. So the kids basically, if you think kids are smarter these days, they are, because they don't have the high lead levels that we had when we were growing up. And if you like to look at charts instead of graphs, this is another one showing the lead levels in children. And in the red is back in the 1970s, 1980s, showing you that average blood level of 15, and that 99.7% of us had lead levels over 5, compared to 2011 to 2016, so relatively recently. And look how that average lead level has come down from 15 to 0.7 in the country, the US. And the percent of kids with lead levels over 5 is only 0.5%. So that's one child in 200. So we've done a really good job. As the contribution of lead in paint has gone down, the contribution of lead in the water has increased. So this came out from the American Academy of Pediatrics right around the time when Flint happened. We all started wondering, well, how much does lead contribute? Because we've spent so much time on paint and soil, and it's gone, the lead levels have gone down. What is the role of water? And so they created this estimation that shows that still the leaded dust in the homes, in older homes from old paint, still accounts for around 40% of your lead, the lead that kids have in their bodies. So about 40% is from the dust in their homes. And then you have about 25% is due to the water, soil ingestion, and then it goes down to 10% from having renovation in the homes, and then just having soil lead around your house where the dust gets in the home. So just to emphasize, the paint is still a big problem, a bigger problem than the water. However, as these lead levels have gone down, we're not seeing the high lead levels in kids that we used to see when I started practicing in the 90s in the city of Chicago, where there's a lot of older homes with leaded paint. I was routinely seeing children with lead levels in the 20s. And we're just not seeing that anymore, which is good. And what we are seeing is families that have higher lead levels due to some of these other sources. Really interesting. I can start at the top left. These are imported home remedies. So this one I think was like a colic remedy from Burma. And then in the middle is a turmeric spice. There are several different spices that have been found to have high lead levels, I think, that are imported. I think because they're selling them by weight, so they throw in some lead to make it. I don't know actually why they do it, but that's what I heard. We had a family in Chicago, we could not figure out where the lead was coming from, and it turned out to be a spice that they bought, and not even at an import store. It was at one of our name brand grocery stores. On the top right are these little cheap charms and cheap jewelry for children. There was a fatality in either Wisconsin or Minnesota like 15 years ago of a child who swallowed a charm that came with a pair of Reebok tennis shoes, had enough lead in it to kill the child. Then just going clockwise from there, there's stained glass. So hobbies that use lead solder to put together stained glass can cause lead exposure. Bottom right is a leaded tongue stud. One of my colleagues here in Chicago could not figure out why a kid had a high level of lead and finally tested her tongue stud and it was leaded. Then Greta and Ezocron, these are both imported remedies. In the middle is leaded glaze used on pottery, which is also imported. That can that can leach into food enough to raise lead levels. Surma and coal are makeups. And then imported candies is that last one to the left. So when you have, when there are people with higher lead levels, like I'm saying, above 5, we got to figure out, especially in adults, because adults don't necessarily aren't taking in the leaded dust in the house because we don't have that hand to mouth, not putting our hands in our mouths like the kids are, or toys in the mouth. So this is just one slide that shows once the lead gets in our bodies, there's these 2 different scenarios. One is the purple one where you have the scenario where someone ingests a big dose of lead. Say we had a kid once who swallowed a bullet. And so the lead level, spikes up and then it comes right down. But if you have low level for long term, you get this lead level that really stays a long-term chronic exposure. And that's when it goes into the bones and is stored there. So it goes from the blood and then it goes into the bones and is stored for up to 15 to 20 years. At low levels, lead poisoning usually has no symptoms at all. I have I'm going to show you what some of the levels are according to their symptoms, but here are all the body areas and organs that are impacted by lead. So as a metal, it travels all over the body. It does go to the brain. It actually likes to go to the brain, and at high levels in adults can cause these symptoms listed here. Can go to the digestive system, the nervous system, cardiovascular system, kidneys, reproductive system, and even cause things like decreased sperm count and decreased sex drive. And in children, we're very much worried about the effects on the brain. So this one is really important too when we're looking at how low the lead levels actually are in the US. So remember that the average lead level in the US is now less than 1. And it used to be around 15 in the 70s. Here are the different symptoms. I'll start on the right side with the adults. So starting down at the lowest levels, there is some evidence that lead can contribute to hypertension that's high blood pressure, around levels of 10. It can affect the ears at levels of 30, the infertility issues around 40. And then when you get up to levels around 100, encephalopathy is kind of delirium, where you start losing your ability to think when your levels get up to about 100. And for children, we've got IQ points lost, and I can show you a slide of that, around levels between 5 and 10. And there are fatalities up around 150 when children get up to around 150. This is just another chart showing health effects in adults at the different levels. So from a lead level between 5 to 40, you can see some of these subtle decreased chance of becoming pregnant, maybe because of the sperm don't swim as well. You got some contribution to high blood pressure, kidney damage, miscarriage, stillbirth, et cetera, et cetera. And then when you get up over 40 is when you start having overt symptoms, like outright symptoms of headache, fatigue, difficulty sleeping, nervousness, memory problems. Now, I'm not going to show a lot of studies. I just wanted to show this one in the red outline that just shows you how, as the blood lead level goes up at low levels, so here's blood lead levels of 1 to 4, so that's pretty darn low, that your risk of having uncontrolled high blood pressure goes up. Now, this is a really typical study of lead effects on adults. The effects are subtle. There's nothing very dramatic. Like you don't see this line going straight up and whoa, you get a lot more higher blood pressure. It's really these subtle changes so that when you look at a whole population of people, you can say, okay, if this whole population is exposed to low level lead, you're going to have some more risk of hypertension, but it's usually not real dramatic changes. So for children, the National Toxicology Program came out, this was in 2012, and it was really one of the first times that they said, okay, we now know, our science is good enough that we know that even at lead levels below 5, there is sufficient evidence for attention-related problems, problem behaviors, and decreased cognitive performance. We had known for a while that that was occurring at the higher levels. Like I said, mine, the average level when I was growing up was 15, probably higher. I joke I could have been a PhD. I only made it through medical school. Don't think I could ever do the biostatistics necessary for a PhD, and I blame it on the lead poisoning. So we know now that the lead poisoning that I probably had. So we now know that even at these lower levels that are 3 times lower than what the average was when I was growing up, there's still these subtle decreased cognitive performance, problem behaviors, and attention-related problems. We've just gotten really good at measuring that in kids with our technology. So why do we worry about kids so much more than adults? I think this picture is great at illustrating it because it shows the density of neuron growth in the first few years of life. So look at the density of the neurons in the brain in a newborn on the far right, and then in a 3-month-old, and then to the far right, a 2-year-old. So you can imagine if a baby's crawling around, grabbing onto things, playing with toys that have been in an old house, if there's paint deteriorating and lead is in the dust, and the baby puts the hands in the mouth and the lead goes right to the brain, you can imagine there's going to be a problem with the lead as those neurons increase in density so much, and that damage is permanent. And this is just one of the second scientific study slide I'm going to show. And just, you can ignore everything except this dark line right in the middle of the gray chart. This is IQ, and this is the blood lead. So you can see that as the blood lead goes up, the IQ goes down. And it's steepest right here between 0 and 10. So children lose IQ points with lead levels between 0 and 10. And on the right, there's just the actual results showing if you increase lead between 2.5 to 10, there's an average loss of 4 IQ points. So even though I showed those charts that the dramatic symptoms only occur at these much higher levels, we now have evidence that even at these much lower levels, even below 5, there are children who have been measured to, when you measure big populations, the IQ levels are lower. There's loss of IQ points with exposure to lead. This just shows you how the CDC's recommendations have changed over time. So in 1991, CDC went from, I think it was either 21 or 23 as what they thought was a normal lead level. They wanted it to be below 21. They put it down to 10, said, okay, our science is showing us problems even down to 10. In 2012, they said, okay, no, now we think it's 5. And we now say that there is no safe level. Just 5 represents the 97.5th percentile. So if you graph all the kids in the country, the top 2.5% all had levels over 5. So they just chose that as a cutoff. And then last week, they changed, or 2 weeks ago, they changed to 3.5. So those levels do not mean that it's safe below 3.5. It just means if you're above 3.5, you're at the very top 2.5% of all kids in the country. So you're high compared to all the other kids, but you can still, as I just showed, you can still have some loss of IQ points even under 3.5. I just have, I think, a couple more slides. This shows the regulations in adults. And this is really important because This is the OSHA standard is at the top right of this chart. So I just showed you how the CDC now says 3.5 is a target level for kids. Look at what OSHA says is okay. So you don't have to be removed from the workplace until the lead level is 60 in adults. Then if you're in construction, you have to be removed at 50, and then you can return to work when you're 40 micrograms per deciliter. So a lot of people, including me, consider that really high and probably should be lower. And on the right side are the recommendations from various groups. If you look down there under like at 20, the American Conference of Governmental Industrial Hygienists says a typical worker, it's okay if they're at 20, but anything over 20, they can have adverse health effects. So, and then down at 5, pregnant women should not have lead levels over 5. So that is the goal for pregnant women, because we know that lead crosses the placenta 1-to-1, goes right to the fetal brain. So pregnant women should be screened for lead. And then the average, the one at the bottom, it shows there the average blood lead level in adults is 0.92. So overall, it's now pretty low in adults and kids in the US. One slide on just what do we do once on management, what do we do when we find high lead levels? There is not much that we can do medically at these lower levels. You know, we do, and I actually disagree with this chart a little bit, because this doesn't even have lead levels below 10, but for any child with a lead level, I would say now over 3.5, because our average is so low in the US. If it's over 3.5, I'm going to wonder where it's from. And in this chart, it says if it's 10 to 19, you figure out where it's from, remove the lead from their environment, and follow up in 1 month. So for any child over 3.5, I'm going to wonder where are they getting the lead, and then I'd probably check it in a couple months. Once they get into the 40s, that's when we start thinking about using pills that chelate the lead. It makes this medicine has the lead just gloms onto it, and then you excrete the lead. But that's not until it's up around the 40s. From between 40 and 80, you're calling your local poison control center, ask them what the next step is. If it's over 80, it usually is an admission to the hospital with IV chelation therapy, and over 100 definite hospitalization and IV chelation. So one last note on nutrition. This is something that we can do. Iron deficiency increases the risk for an elevated blood lead level because the lead and iron fight for absorption. So if you have iron deficiency, the body is if you have iron deficiency in your blood, your body is saying, oh, I need more iron. Here's lead. It looks just like iron. I'm going to suck it up. So you absorb lead better if you're anemic. Foods with calcium and iron and vitamins are good prevention because they will prevent that absorption. So a daily multivitamin with iron should be used in anybody with an elevated lead level. These efforts will likely not lower the lead that's already present in the body. They don't, well, I was just reading an article recently where there are some vitamins and flavonoids that have some chelation properties, but there haven't been studies that show that they really lower the lead levels a lot. What they do is they prevent absorption of any further lead. So I just wanted to, again, introduce to you this service that is provided by the EPA and the CDC branch called the ATSDR, that provides for expertise in children's environmental health. And as an occupational medicine physician, I also do adult environmental health. So you can definitely call this number, email us to our center. We cover all those pink states in Region 5 with any questions. And we are funded to do a lot of lectures like this especially to healthcare providers, because we know that healthcare providers don't learn about environmental health or not much about lead in medical school or residency. So we are a resource. We do telephone consults, we can do clinic visits, we offer expertise to public health and environmental agencies. We do a lot of training of doctors and nurses and other health professionals. That's a screenshot of our website. And these are all our folks that we have. Now, one of the things I've been doing in the last few years is trying to identify one person in each state to be a liaison. And Jennifer McDonald, Dr. McDonald, is our liaison in Michigan. And I know that she has been working closely with the water distribution program. And I was in contact with her today, and she was encouraging people who had questions about water distribution to call the 211. Oh, that's another, oh, I meant to take one of those out. Anyway, that's an updated one. And I'm happy to take any questions. Thank you.